We are just really 2 days away from open enrollment through Maryland's health exchange, and following last year's $200 million debacle for its exchange website, the state wants to rebuild your trust. One person with an inside view of just how much the site has changed is Dr. Peter Beilenson. He's chief executive for Evergreen Health Co-op, and he's one of the providers for the state. He's joining us now for this week's Take Action Thursday. Thank you so much, Doctor, for coming in. Now, you are not a designer on the website. I just want to clarify that. You are an actual provider in the healthcare for the state.
Correct. We're one of the insurance carriers. We're a nonprofit insurance company that's competing against Blue Cross Blue Shield, Care First, Aetna, Cigna, Kaiser, et cetera.
One of the first things that when you go to this website, we hear about it, November 15th is the launch date. But if you click on news and events or anything, it kind of breaks down. It's not really the 19th that you can use the website. I mean, the 15th. It's not until the 19th. Is that?
Correct. Actually, you can use the website starting last weekend to do shopping, which we're going to show people now. There are a few locations on the 15th, which is this Saturday, that you can be helped to go online. But it's not till the 19th that you can go on by yourself and literally apply. So that's the 19th is the hard start date.
Okay. So when you go to Maryland's website, it's a secure site, marylandhealthconnection.gov.
Correct.
This is what it looks like. Now, we've saved some time because the next step is just either clicking on individual, family, or employer.
Correct.
Once you do that, we chose family just because the majority of people using it. And so we started the process. This is what the next page looks like when you do that.
Right. It's really quite simple. It's much simpler than last year. It should work much better. And by the way, this, putting aside all the politicized relationships that have been going on and this rhetoric, et cetera, this is really a great way of getting affordable coverage for people who would not otherwise be able to get affordable coverage. Probably the biggest improvement in healthcare system in the United States in my lifetime. So it's really a good deal. Whether you're for Obamacare or not, this really makes a difference for people. So you basically put in the county of your residence, your age, and your household members' age, whether they're a spouse or a dependent.
And we chose a 50-year-old, a 47-year-old, an 11 and a 9-year-old
So a family of 4 in Baltimore County, $59,000, which is about the average median income or so for the families in Baltimore County with 4 people. And you hit next, and we'll see if that works. You may have to do the...
And now it gives you some explanations.
Right, sorry. Yes, it does. So it flips you to the most cost-effective, most comprehensive coverage available for you, which is a silver plan. There are 4 metals. Bronze, silver, gold, and platinum. This is the best for your income level. You'll see here that the 2 kids are actually eligible for Medicaid. Small premium to have to pay, but the 2 adults are available for subsidies to pay for their premiums. And then you hit
hit the next button, and we're going to wait on that next button because when we come back after the break, we're going to see exactly when we scroll up what it's going to cost somebody monthly to pay for these plans.
And we'll explain how the plans work.
Right, and then we'll take some questions from you out there. In fact, because after the break, Dr. Peter Beilenson, Chief Executive for Evergreen Health Co-op, is going to be back taking your calls about the new State Health Exchange site. He just showed us how easy it is to shop on there. If you have some questions, our phone lines are open right now, 410-481-4545. You can send us a tweet at Fox Baltimore, or you can go to our Facebook page. We want to hear from you. You're watching Fox 45 Morning News, all local, all morning.
Next wheel, we're hanging 10 on the Big Island with best friends. Wheels in Hawaii.
Tonight at 7:30 on Fox 45.
The Jeopardy! Tournament of Champions.
Tonight at 7 on Fox 45.
Oh, Denise, I love this new bedroom set.
It's all from Value City Furniture.
And it was a steal.
I knew it! You're going away for a long time, Denise.
A steal means it was super affordable.
Tell it to the judge.
She just did. Jury, have you reached a verdict?
We have, Your Honor.
During the Veterans Day sale, get 10% off your purchase, plus no interest financing till 2016 when you spend just $9.99 and up. Value City Furniture. Style comes easy.
One of the greatest things about UTeach is that it allows us to get into the classroom early.
My very first lesson, I was shaky, I was nervous. I've gotten more confident, I know what I'm doing. So being able to be in the field and do that has really helped.
It's what I want to do, so having the experience now definitely makes me excited for the future.
It's teaching teachers how to be teachers.
Trying to get an insurance company to send you money when you're hurt? That'll turn a car wreck into a nightmare. Who knew? We know. And we know how to get the insurance company to pay you all the money you deserve. Call the heavy hitters. We're attorneys Gilman and Badigi. We'll work to get you paid without making you go to court.
What we know can get you more money than they're telling you about.
Injured in a car wreck? Call us, attorneys Gilman and Badigi.
And let the heavy hitters end the nightmare.
The heavy hitters are the ones for you. 1-800-LAW-6162.
We're back with Dr. Peter Beilenson. Actually, he is here with the Health Exchange, and he's been showing us exactly how easy it is for a family of four in Maryland, $59,000 annual income. That's about average of what we have to go through the website. In fact, we started it. We put in a 50-year-old, a 47-year-old spouse, 11-year-old, and a 9-year-old sibling, or I guess siblings in that, and hit the plan at $59,000. And this is what came up next, is the next screen.
Right, so this is kind of the fine print, but basically it's talking about these are qualified health plans under the Affordable Care Act. And what comes up is at least initially, is the lowest premiums for you with your $222 tax credit, which is part of making it more affordable. So you're saving about $3,000 or $2,500 a year over what the premium would be. The first that comes up is Kaiser. The second that comes up is Evergreen, which is us. And it's a plan to really quickly walk through the plans. This is the monthly premium.
I'm going to pull it up just a little bit.
Monthly
right there
premium. The emergency room costs are 20% co-insurance after deductible. So there's a deductible, how much you have to pay before you start getting benefits. It's $2,200, which is much better than the $5,000 or $6,000 high deductibles that many people got last year. And there's a $20 copay that actually before deductibles for primary care. So instead of having to pay for your deductible first, you're only paying $20 to go see the primary care doc, and maybe 20% of the actual cost for an emergency room. The total out of pocket is $9,500
for the whole year.
That's the most you can possibly pay, which is drastically less than what previously been the case. So you've got to look at all the things. You look at the monthly premium, you look at the deductible, and you compare other deductibles are $3,000.
And right here below each one is a link where you can go delve deeper into it if you'd like to too.
Right. So you can check and see what's actually in the plan, and it's a much, again, the bottom line is this is much more affordable coverage available for people. It's really something people should go to, whether they agree with the politics of it or not, because it's a benefit for most people in Maryland that did not have insurance before.
Dr. Beilenson, we appreciate this. And of course, we're going to be discussing this for the next few days here as this opening enrollment begins. There's a lot of places that people can go physically and actually have help as well with that. Thank you so much. Of course, a lot of that information is on our website. Well, coming up at 8, a plane in Louisiana just goes missing. Where agencies last saw the plane and who was on board.